All right. I want to do a discussion about a healthcare system in America, right? And why I so doggedly advocate for a national healthcare system. And I'll say this right off the cuff, like if there's anyone out there who thinks that it's a bad idea or thinks that that's not the direction we should be moving in fact, they think that it'll make our country worse. Um, I'm inclined to say get diabetes, nigga, but I'm not gonna say that because that's mean, and I really wouldn't wish that on anybody. I have it, and it fucking sucks, right? But at least try to understand, try to envision, walk in someone else's shoes. Try to get to know someone with a chronic illness that needs a consistent medication stream. You know, even worse, try to know someone that needs a consistent medication stream. That's something that's not readily available and it's very expensive. I don't have that problem. I have the problem of expensive, but I don't have like the over some chronic conditions require a lot of care. You know what I mean? Get to know someone who has a chronic illness and see if you still think that we shouldn't have a national healthcare system. So I want to talk about my recent experiences, right? I'm currently using Humalog, right? Fast-acting insulin. I believe it was the first insulin ever developed. This is made by Eli Lilly. And if I didn't have insurance, it would cost $300. And I want to talk about why recently I had to pay my mom helped me with that. We had to pay $300 in order to get this little guy right here. And I want to talk about why. And it informs why we need a national healthcare system. Now, I'll start with this. I used to go to a healthcare provider in Brownsville, Brooklyn. They're called Brookdale Hospital. If you know anything about Brooklyn, you know Brookdale Hospital, and you know it ain't shit. You know it ain't shit, right? Probably one of the worst providers in the Brooklyn area, in Kings County. They have a place in Brooklyn called Kings County Hospital. We call it Killer County because they kill people. The overarching point is this. Healthcare providers in poor communities are the worst. And everything in poor communities are the worst. Because when you put things on the capitalistic table, capitalism has a lot of short-sightedness, has a lot of blind spots, things that are missed within a capitalistic system, which leave people fucked up, right? So if you put healthcare on that same plane with everything else, you're going to leave people fucked up in reference to their healthcare. I hope that makes sense. I hope that I said that in a way that makes sense. But that's my main point. So the only reason why I started going there is because my mom was over there and I figured, I'll go see my doctor when I got to see my doctor, get my prescriptions filled. Go see my mom one time. She's like 6 blocks away, right? Right? It was great, right? It was one of the worst things I did as far as my health care. One of the worst things I did. Incompetency at its apex. Okay. Hey, I need insulin. All right, I'll send a prescription to your pharmacist. Who's your pharmacist? Great. So I call. Hey, did you send a prescription yet? Oh, we're sending it now. And this was like hours later, right? Okay, you're sending it now. I'm mad, but whatever. You should have sent it a while ago. Did you send it? Yeah, we sent it. Okay, great. I have to call the pharmacy now. Hey, pharmacy, did you get the prescription? Yeah, we got the prescription, but the instructions on the prescriptions aren't right for the usage. How are you using the insulin? I tell them. Oh, no. Yeah, the doctor has to send it over again. Okay, I get that. Annoying, but I get it. Hey, doc, it seems that the prescription that you sent didn't have the instructions on how to use the insulin. They need that in order to fill it. Why the fuck I gotta tell you that, doc? I didn't tell doc that. I should have told doc that, but I'm a nice guy. I told myself, why the fuck I gotta tell you that, doc? But incompetency. And then I okay, doc, did you send it? Oh, yeah. And by the way, I'm not talking to doc. I'm talking to nurse, right? Nurse, did you send it? Oh, yeah, I sent it. Okay, great. Hey, pharmacy, did you get the corrections to that prescription? No, we didn't get it yet. You got it. I'm not getting it. I had to deal with this for about a year when I was over at Brookdale, right? So, my mom doesn't live there anymore, so I figured, fuck it, I'm out. Right? So I ended up, just to put all of that into perspective, every month I was late getting insulin. I had an emergency. There were 12 months last year, probably like 6 months out of the 12 months, I had an issue getting insulin where I had to make some emergency moves, do something. in order to get my insulin because I was behind, type shit. Because they couldn't figure that out. I had to go through that. And by the way, I'm working. And my only, I have an hour of lunch. So I'm literally spending 45 minutes of my lunchtime doing this. And then I have to get back to work. And by the time I get out of work, the place is closed. They're not servicing anybody anymore. So I can't call anybody or do anything. Are you starting to see the picture? I have discussions with some people that are in the medical field that disagree with Medicare for all, and they want to stress personal responsibility, right? That's like a conservative thing, like personal responsibility. If you're on time with your shit and you take care of your shit, you know what's going on, things will be better. Things are better, yes, but I still have these issues. Being on top of shit is calling niggas every day. That's what the fuck I was doing, and I'm still having these issues. I still have this one vial of insulin that. Let's get to that. Now, I went to Georgia. I just got back. Had a great time with my family and everything. I have to quarantine for a couple of days, so I shouldn't really be outside like that. However, I have to get insulin, so I have to go to the pharmacy and figure that noise out. So I go to the. This is what happened in Georgia. I had a visual conference, my first doctor visit since I lost my job and I had to get Medicaid. Right, my first doctor visit, and I tell her. I need three vials of insulin, blah, blah, blah. And she hooks it up. She writes a prescription, sends it to the CVS locally. I go over there in Georgia to get that prescription filled with everything she put on it that I need, over $1,000. Because, again, I was Medicaid covered. Medicaid is a super state-funded program. So Georgia don't fund their Medicaid, and they don't have the same Medicaid program that they have in New York. So I couldn't get my insulin. I had to pay $300 for a vial of insulin. I had to pay $300 for one vial of insulin. Now I needed 3, and they gave me other things, and that totaled $1,000. I can't afford that. Who can afford that for insulin? You know what I mean? It's something you'll need every month, right? Of course, that wasn't gonna happen. So I ended up. My mom helped me out, right? I had to pay $300 for a vial of insulin. Crazy times. So, look, if we had a national healthcare system, that wouldn't be an issue. The idea is the government uses everybody as a bargaining chip. We're all bargaining chips, right? We bulk purchase insulin from all these providers. Lilly, whoever the fuck, Novo Nordisk, fuck that motherfucker too with his Novolog. Fuck that motherfucker. Just cuz, right? Just cuz. Yeah. Oh, now actually, no, I like them. They gave me like a kit. They gave me like something when I didn't have insulin in the past and I didn't have a job. They hooked me up with something. So Novo Nordisk, fuck y'all kinda, because you're a private entity and y'all jack up the prices of your insulin just like any other private entity that sells insulin does. So fuck you for that. But thanks for that kit. That shit was dope. Anyway, and it helped me a lot. I sincerely appreciate that. But fuck y'all. But so anyway, the point I'm trying to make is that we should have a national healthcare system that purchases insulin in bulk for everyone at a cheaper price because you're purchasing in bulk for everyone, right? You tell that international corporation that wants to sell drugs to our country, okay, you can sell drugs, but you have to sell it at this rate, and you have a buying base of how many people have diabetes in America? Like tens of millions of people, 20 million, 30 million, something like that. So you have a huge base that you can sell to. So knock your fucking prices down so that people can afford it because they have to live and shit, right? But, that didn't happen. So anyway, I couldn't get my prescription filled in Georgia, like I said. I had to come back to New York. So when I come back to New York, and I want to give a little history. Before I left for Georgia, I ended up I had an emergency. I had to run across the bridge. Like I said, I didn't want to do anything in Brooklyn with my healthcare anymore. I'm leaving the Brooklyn healthcare system. So as part of that, before I went to Georgia, I went across the bridge to a little north of Union Square, a little north of 14th Street in Manhattan. I went to what's the place at? They didn't have a fucking place. Mount Sinai. Great provider. I got my insulin in about 25 minutes, which is amazing. Emergency. And they wrote me a prescription for 2 refills. Good. Generally, in the past when I've had emergencies with insulin and I had to go to an emergency room to get insulin, take me like 5 hours at Killer County, Kings County in Brooklyn. 5 hours. And my mom came like, bro, I was younger. My mom came through like, what's going on? Why is it taking so long? I'm like, fuck if I know. I didn't tell her that because I wouldn't cuss at my mom, not on purpose. But I don't know, mom. And eventually I got my stuff and I had to go home. I go to a place that's a little more wealthy, in Manhattan, in the heart of Manhattan. It takes me 25 minutes to get my insulin. When you put medicine on the same capitalistic system as other like cars, we found out that they loan cars to black people at higher interest rates. Why? Because of capitalism, and capitalism is a lot, in a lot of ways is intrinsically linked to racism. That's an example of it. So when you put insulin and things that people need on that same table, you're making those things that they need. They're subject to the same blind spots that capitalism has for blacks. I'm saying it weird, but I think you get what I'm saying. I want to move on. So before I went to New York, I had Medicaid, right? Straight Medicaid. I lost my job. COVID had something to do with that. So basically I got my insulin. I got 1 vial of insulin. You know, after that night I told you about it, I ended up getting that prescription filled, straight Medicaid. So in that interim, Health First started being my provider. I don't understand what it is, but when you have Medicaid in this state, they like to link it with some private insurance, right? Some private insurance shit. So I joined with Health First. Now before I went to Georgia, like I said, I had straight Medicaid, and I got my insulin easy. I come back from Georgia. I'm looking to get that second refill. Remember, I told you the doctor gave me 2 refills. I came back to get the second refill. Health First doesn't have a contract with that Rite Aid. So I had to transfer the prescription to a CVS so that they could fill it because they have a contract with Rite Aid. I thought the private interest is supposed to make things easier, right? Like I can get access to my shit quicker because there's a private industry that's driven to make capital, and they want to provide the best service because they want to be around. They're responsible business people, aren't they? Fuck those motherfuckers. Because of them, I couldn't get my fucking insulin, and I had to go somewhere else, and then they filled it there. But remember, I have to get 3. I have to get 3 vials of insulin every month because I use an insulin pump. If I use an insulin pump with just 1 vial, it'll run away super quickly. It'll be done quickly. So I'm literally rationing my care, which is a term Bernie used, and I'd be like, damn, that guy died rationing my insulin. I'm rationing my insulin, I should say. Sorry. And I'd hear Bernie talking about it, like, damn, that guy rationed his insulin, and now he died. And I realized recently, that's what the fuck I'm doing. I've been doing that since I lost my job in March. I've been doing that since March. I should be taking this through a pump. I'm taking it, I'm taking shots of it now because I have to take less. Because I can't get much more than 1 fucking vial at a time. All right, so I got I remember I told you I was in Georgia. I had my visual meeting with the doctor. She provided me with those 3. I couldn't get them in Georgia. I come up here to get them filled. They only give me this. And I tell them, yo, you made a mistake. Like, I need 3 vials here. And I have the prescription here. They have it in their system. However, they're telling me now that I have to get something called Admelog, because it seems the same shit. The Health First or whichever provider can't provide me with the Humalog. Whatever the case is, it's some contract that a motherfucker signed that they only can provide me with Admelog. So do you see what's happening? They're setting up the streams in which that they want to receive their income. They're setting it up like, oh, we want this network, we want only access to these contracts, this type of thing, because it pads their bottom line. But me as a consumer, me as a I don't want to say consumer. I honestly don't really like that word. Me as a individual who needs this insulin in order to live has to go through a quandary to follow their money routes and figure out how they want to make their money and apply to what they want, as opposed to doing what's easier for me and my health. That's the issue, the inherent issue with having a profit motive behind providing health care. If you can't understand how that's immoral, I don't know what the fuck else to say to you. And if you don't know anyone with a chronic illness that has to deal with shit like this, get to know somebody. Talking to me about personal responsibility, which is a conservative thing, right? Personal responsibility. That's all the fuck I've been doing is personal responsibility. That's how I'm still alive. It's because I've been chasing down providers, chasing down insurance companies, chasing down pharmacists, trying to get shit covered, trying to get shit done for myself. That's a stress that I shouldn't have to deal with. And I'm fucking tired of it. I'm in the hospital today. The pharmacy today. And the lady tells me I have to get another type of insulin out of nowhere. But first of all, I'm waiting for her. She's on her computer trying to figure out the quandary of shit herself. Who's providing this? Who provides that? I could see that's what she's doing. And then she says, okay, this is the issue. They won't cover Humalog. They need Admelog all of a sudden. And that came out of nowhere. I never heard of Admelog. Fuck Admelog. Just cuz. I'm sick of it.